Yeah, one of the most important genera. And within this genus, there are at least several species which can cause disease in human. And some of the disease are actually very dangerous and not easy to be cured. Today we'll focus on Mycobacterium tuberculosis. Mycobacterium are rod-shaped, aerobic, so they prefer the existence of oxygen. And they are acid-fast rods, yeah. And they don't form spores. They don't form spores. And they do not stain readily. They do not stain readily because this bacteria is very special because on their surface, the structure of the cell wall of a Mycobacterium is different from the regular gram-positive, gram-negative cell wall structure. It contains a thick lipid layer on the outside, and those lipid layers are hydrophobic. So, such as the dyes in water solution cannot stain those lipids, cannot penetrate those lipids. Yeah, they are acid-fast bacilli. Acid-fast means that this bacteria, after staining, they are more resistant to decolorization by acid or alcohol or acid-alcohol mixture. So, to decolorize the stained bacteria, the dyes can stay in the bacteria for a long time. So that's why we call it acid-fast. There are two important species within this genus. That's Mycobacterium tuberculosis, and also another one is called Mycobacterium leprae. And both can cause severe disease. The first one, tuberculosis, is one of the life-threatening disease even now. Okay, Mycobacterium tuberculosis. Before the discovery of antibiotics, there is no curement for tuberculosis. And that's why it got the name of white cancer, because you cannot cure a patient with tuberculosis. And the patient will die while suffering a lot and finally will die. And the infection is spreading from person to person. And WHO set the aim to reduce the number of tuberculosis infection, to reduce the ratio of tuberculosis infection. But it seems that the aim cannot be achieved, at least by the end of this year. And in recent years, there are more challenges of Mycobacterium tuberculosis because there are more and more antibiotic resistant strains coming out. More and more like strains resistant to multiple drugs. So that makes the case even worse. And Mycobacterium tuberculosis is also one of the most frequent co-infection in HIV patient, in AIDS patient, because their immune system is destroyed and they don't have enough CD4 T cells, and the immune system cannot clear out invading MTB. You can see that the name of Mycobacterium tuberculosis is too long, so that is why within the field people usually say it MTB. That's short for this bacterial name. And last weekend I attended a conference, academic conference. At that conference, people discussed about MTB, and the challenges are still there, and we cannot fight or eradicate MTB within a short time, and there are still a lot of work to do. And you can see this MTB, they are typical organism, and you can see the shape under electron microscope on the right. They are kind of thin and straight bacilli in tissue. But if you culture the bacteria in media, the morphology is kind of variable. You will see like different morphologies. They do not stand readily. So that's a common feature within this genus. They are acid fastness, so they are more resistant to the decolorization of alcohol and acid. So with this characteristic, you can use it and try to identify the existence of MTB. For example, you collect the specimen and make a smear, and you stain it with acid-fast stain. And if there are other bacteria, those bacteria will be decolorized. You will not see them, but this MTB are more resistant. You can see that they are stained. So this is the acid-fast stain. You make a smear and fix it with heat, then cover it with a dye, the cover fuchsin. I cannot pronounce its name. This is a dye which shows the red color. You cover the smear with a dye for 5 minutes, stain it. Then you wash the smear with water and decolorize it with acid and alcohol. And when you decolorize it, if there are other bacteria in the smear, you will decolorize other bacteria, but the MTB will keep the dye in the cell. Then you wash it with water and then counterstain for 1 minute with methylene blue dye. It's another dye. Then this methylene blue will stain the background into blue color, while your MTB bacteria will stay the red color. So this will make them stand out. And after this acid-fast stain, you can find out the existence of MTB in the smear. Okay, so this is how to stain and check the morphology. And also we can culture the bacteria. You can, actually there are now multiple types of media which can culture the MTB. But keep in mind that MTB is one of the most difficult bacteria to culture. One reason is that they require a long time to grow up on the medium. For if you culture E. coli, you can get the suspension, bacterial suspension turbidity within hours, and you can see the bacterial growth. And the generation time of E. coli is only like 20 minutes, 30 minutes. That's pretty short. But for MTB, the generation time is 18 hours to 24 hours. So that's almost a day. Yeah, it takes 3 to 4 weeks or 2 to 3 weeks to see the MTB colony on the medium. When I was in college, like you, in undergraduate school, I set up the culture method for the lab. to culture MTB in the lab. But for sure, that's not an virulent strain. I used an virulent strain, so it's H37RA, which can be cultured in like ordinary lab, and I grow it on like the surface, like this one in a tube, and you can actually see the bacteria grow on the surface after 2 weeks. I also cultured the MTB in liquid, but for liquid culture, broth culture, the bacteria actually are not growing inside of the broth. So they can float. They float on the surface of the broth and grow there. So that is the broth medium. And this solid medium, you can see that the green color. The green color is because of there is addition of malachite green dye. Malachite green is a chemical, organic chemical. That organic chemical can inhibit growth of other bacteria, but it does not inhibit the growth of MTB. Okay, so this is how to culture the bacteria. And the growth characteristics, they are obligate aerobes, so they grow better with oxygen. They require oxygen. And their biochemical activities are not characteristic. And another property of this growth is that they grow very slowly. The doubling time is about 18 hours or like that. And after growing, you can check their the morphology of the colonies. You can see this. The colonies might be rough, or sometimes they look like a greasy. You can see that there might be some shining light, and you might you might think that there are some oil on the top of the colony, and that's the lipid produced by the bacteria. This is how the MTB colonies look like. Morphology and identification for their resistance. Just now we mentioned that they are resistant to the malachite green dye, and you can add this dye, this chemical, to the medium, so that it will inhibit the growth of other bacteria. And also they are resistant to antibacterial agents such as penicillin. Penicillin works on the synthesis of the cell wall, the peptide glycan, but this bacterial cell wall is very special. You cannot treat your patient with penicillin. They are resistant to acid and alkali. Okay. And also they are resistant to drying. MTB can survive for long periods, hundreds of days in the dried sputum. So if the patient spilled out some sputum, and even after the sputum dried, the bacteria can survive in it for hundreds of days. So that is why MTB is not easy to eradicate. These bacteria do not produce endotoxin, they do not produce exotoxin, and they are not invasive. And this is interesting because a pathogen, they don't produce any toxin and they are not invasive, but they can cause lethal disease. And this lethal disease is mainly due to the release of lipid virulence factors. And they can get internalized into the cell, and they can live inside cells. And that's a safe niche for the bacteria can avoid the attack by immune system. They do produce lipids, protein, and polysaccharides. Those we'll introduce those different material later. For lipid, they can produce phospholipids, and these phospholipids can stimulate the proliferation of mononuclear cells, cause tuberculosis or tissue necrosis, and they can produce wax-D, which is an adjuvant and can cause delayed type hypersensitivity. Sulfatide, which can suppress the phagosome to combine with lysosome. So this sulfatide will inhibit the fusion of phagosome and lysosome, so that will enable the bacteria to survive intracellularly. They won't be killed by enzymes in the lysosome. They can also produce cord factors, and those are the different lipids. So I guess you can find detailed information to help you study this part in our textbook. And for pathogenesis, actually MTB infection usually happens in different stages. The primary infection, later we'll introduce that. So after the droplet containing TB inhaled through nose, they can get into our lung, and there they can infect neutrophils and macrophages and hide in the cell. But they can also spread to other places of our body, carried by those infected cells, such as macrophage. The macrophage will get out of the lung and transport into like lymph nodes and cause systemic infection. So that is why MTB infection happens not only in the lung, but also in other tissues, such as in the intestine, in lymph nodes, and also in bones. Last year I saw a research paper. They studied the bones in Russia. North part of Russia, some area, it's always frozen. So when people died, maybe hundreds of years ago or thousands of years ago, they died and buried, and their tissue, at least the bones, can be preserved pretty well. So they dig out those bones and check those bones, and they actually find MTB infection hint in the bones, and they can make sections of the bones and study the morphology of the infection site. So this MTB infection is a severe problem. It's not confined in the lung. This is the infection in the lung. It causes the caseous tuberculosis. The caseous tuberculosis, it got the name of caseous because when you check these morphologies, looks like the dried milk or dried cheese. So that is why it got the name of caseous. Yeah, cheese-like. It's yellow or pale yellow color and look like cheese. So it causes the caseous tuberculosis. And the different stages of MTB infection include primary infection and also secondary infection. The primary infection is the first time of infection. Usually there is an acute exudative lesion rapidly spreads to regional lymph nodes. But this lesion often heals rapidly. So usually the MTB primary infection does not cause severe results. The lymph node continue MTB will undergo massive caseation, which usually calcified. So there is some change in the lymph node. First, there is a caseation, and when the cells die there, and finally they will calcify. Calcify means the dead cells or dead tissue there will get harder and primary. Yeah, kind of necrosis. Necrosis is one of the steps. The cells die through necrosis. And after this primary infection, the tuberculin test result will become positive. Let's see, later we'll introduce this tuberculin test. For a second type of reaction is called, second type of infection is called a reactivation type. After the primary infection, the MTB actually stay in our body. The immune system cannot completely get rid of the bacteria. So usually they become latent in the cell and stay there for a long time, or become latent in the cubicles and stay there and keep quiet for a long time. But once they get reactivated, they can cause another infection. This second infection, reactivation infection, can cause chronic tissue lesion and formation of tubercles, caseation, and fibrosis. And this will cause a severe problem and can cause death. And the immune system actually will respond to MTB infection, such as the immunity against the localized tubercle bacilli, retard their multiplication, limit their spread, and also reduce the lymphatic dissemination. This is immunity. After infection of MTB, we human will develop a hypersensitivity. This is a delayed hypersensitivity reaction, because you learn immunology and you should understand the delayed hypersensitivity reaction. Yeah, if you are not familiar with this term, you should check the textbook of your immunology, and hopefully this will, and probably this will be covered in our final exam. Tuberculin test, that's a popular test right now. Yeah, it's step 4. Tuberculin test is a popular test for MTB infection. So what you do is that you use the components or some material from MTB and inject it into the skin. So that's a place between dermis and the subcutaneous tissue. You inject a little amount of MTB material. Previously, we used the old tuberculin. This is a concentrated filtrate of broth, which contain a lot of components from MTB. But right now, we are using the purified protein derivative, short for PPD, purified protein derivative, and inject in the skin, and to see whether there is a hyper sensitivity, the delayed type 4 delayed hypersensitivity. If there is, that means this person might get infected, or that this person get immunized. In China, we give the kids a BCG vaccine. You know, BCG vaccine is attenuated vaccine containing like the bacteria which can grow slowly in the body. And after the kid received the BCG vaccine, they usually develop this PPD results positive. So that is why PPD method in China usually won't give you very useful information, because almost everyone is positive. Not because they are actually infected, but because they get the vaccine previously. But in other countries, in countries without BCG vaccine, they can still use this tuberculin test to see whether the person is infected or not. Okay. And talking about the tuberculin, I'd like to introduce a little story about it. You know, when we introduced Dr. Robert Koch, the German doctor and also the famous microbiologist, at that time he tried to find some derivative from MTB and use it as a vaccine to fight against MTB infection. What he actually used is actually the tuberculin, and he thought that this tuberculin will work as a vaccine to help the people to protect people from infection. But actually, it does not work. Even though Robert Koch received a Nobel Prize because of his work on MTB, but his work on tuberculin is not successful. And after that, he switched his work from MTB to cholera, and he traveled a lot to India, to other countries to study cholera. And tuberculin vaccine was forgotten. But later, people find that the tuberculin can work another way. So that's for the test, but for the diagnosis test. And then later, people picked up the tuberculin and use it to have this skin test, and still it's useful. Okay, clinical findings of TB infection. The patient will feel fatigue. They are very tired, weakness, and they will suffer from weight loss, fever, and night sweat. And this is typical symptoms. And it's really painful, actually. The patient will cough and spit out blood a lot, and they cannot stop coughing, and they cannot breathe normally. And it's very, it's a lot of pain. And especially during the time, there is no curement, there is no medicine, no antibiotics to treat the patient. So in different countries, in different areas, patients are receiving different treatment, including herbal, different herbs, and maybe some ridiculous treatment, but they actually don't help. The bacteria can spread from through the bloodstream, and that's the bloodstream decimation, and leads to miliary tuberculosis. Sorry, this is a typo. It's not military, it's a miliary, like this one, miliary tuberculosis. So you will see the small particles, the small dots in the lung. So each one is a miliary tubercle. That's because of the spread of the bacteria from one local infection to other parts. Laboratory test. We can collect the fresh sputum or gastric washing, urine, pleural fluid, even joint fluid. I mentioned that MTB infection can spread from one place to all over the body and can infect other type of tissues. So it depends on what place of infection you identified. Even at the joint fluid on the bones, you can find MTB. So you can collect a lot of material, a lot of specimens all over the body. And after you collect this, we should decontaminate and concentrate the specimens, because MTB is so dangerous. You don't want the bacteria to spread. So usually in China, diagnosis or treatment of MTB infection is in certain hospital. It's not in every hospital. Only in certain hospitals they receive treatment. And you need to process the specimen and further examine the specimen following this procedure. This is just it contains a lot of technique details. We won't go through those details. And after you treat or process the specimen or concentrate the specimen, we further examine the specimen, like the acid-fast stem we introduced just now, and see whether you can find some acid-fast bacteria, and we can culture it. And the cultivation method is one of the most reliable experiment, because you need to culture the live bacteria and see their colonies and check their characteristics. But keep in mind that especially for MTB, this culture is really, really difficult. They grow slow and it's not easy to culture. For a lot of cases, you cannot get a colony after culture, even after 3 weeks. Even there is live bacteria, it's not easy to culture them. And we can use DNA detection. So usually in the hospital, people use RT-PCR, fluorescent RT-PCR, to detect the TB DNA directly. That is more sensitive and also a faster way. You can get results within a couple of hours. So this is a diagnostic test. For treatment, there are some medicine available, such as rifampin and also isoniazid. These are the 2 first-line medicine used to treat MTB infection. For most of the cases, they will work. They can kill the bacteria and can inhibit the bacteria, but the patient needs to take the medicine for a long time. But the problem is that, as I mentioned, there are more and more drug-resistant strains and even multiple drug-resistant strains. And that makes these 2 medicine not working at all. And there are also second-line drugs, including different antibiotics, you can try if the patients are resistant, the bacteria are resistant to the first line of drugs. And you can also use an antibiotic called streptomycin. So that's one of the common antibiotic to treat MTB infection. For prevention, the patients with active tuberculosis, you can treat the patient with supporting treatment, so help them to recover, or give them medicine to inhibit the bacteria. And we can also use vaccine. So there is only one vaccine available. That's the BCG vaccine. This is a very traditional vaccine that has been used for a long time, over 100 years, I think. But keep in mind that BCG vaccine does not work in adults. You can give a kid some BCG vaccine and that works, but once a person grow up, if you give that person BCG vaccine, it doesn't work at all. So that is the reason why in some countries they don't use BCG vaccine at all, and people are trying to make a new type of MTB vaccine. But right now there is no new vaccine available except for the BCG. Okay, so basically that's the brief knowledge of MTB. For the part of Mycobacterium leprae, we won't talk about it on our lecture. I think you can find some information on in your textbook. And the MTB, the Mycobacterium leprae was once one of the dangerous infection in the world, but now I think the problem is well controlled. Okay, on this slide you can see some videos on TB or MTB. So you can log on to the Superstar platform to watch these videos, and this, I guess, it will help you to understand our material. And yeah, so that's all for today. And I wish that you can spend more time preparing for our test and meanwhile for our final exam. And believe me, that will help. And don't forget to finish our test today or tomorrow or over the weekend. We have 2 tests going on. Okay, and that's all for today. Next week we'll talk about viruses.